Hello, my name is Lindsay Coach and my partner is Savannah Smith, and our presentation topic is access to care. Social determinants of health are the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. In this presentation, we will be discussing how access to health services can affect the health of an individual as well as a community. Additionally, we will discuss inequalities, disparities, and the role of the APRN in assuring that healthcare is accessible. A lack of access to health services is mainly due to several barriers, including a high cost of care, inadequate or no insurance coverage, lack of availability of services, lack of culturally competent care, lack of transportation, and living in a rural location. The populations who do not have access to health services often include those who do not have insurance coverage, have not found a provider they trust, or live in a location where it is difficult to reach a health facility. Additionally, access to care varies based on race, sex, ethnicity, disability status, age, socioeconomic status, sexual orientation, and gender identity. These barriers to access lead to an impact on personal health. Issues that may present include unmet health needs, delays in receiving appropriate care, the inability to receive preventative services, financial burdens, and hospitalizations that would have been preventable. Uninsured people are more likely to have poor health status, are less likely to receive care, be diagnosed later with long-term illness, and die prematurely. Those without a primary care provider whom they trust often do not receive the care they need. Having a PCP leads to better patient-provider communication, increased likelihood the patient will receive the care they need, and lower mortality. These barriers to access to care also lead to an impact on community health. Issues that impact a community include limited resources within communities. Some barriers to access to care for those in rural communities may include financial means to pay for services, means to reach and use services along with the ability to pay for time off, and confidence in the patient's ability to communicate with providers if healthcare literacy is low. Older adults are often impacted most due to chronic health problems, higher poverty rates, more residents without health insurance, higher rates of substance use, and exposure to environmental hazards. The lack of access to care affects the community in that it leads to an increased risk of poor health outcomes. These factors affect the individual person, but they also affect the overall health of the community if the person compromises the health of others due to the inability to get treated or receive preventative care. In racial and ethnic minority groups, there is a lower likelihood of having a usual source of care, fewer provider visits, and fewer health expenditures. Women tend to access health services more often than men, and individuals who are elderly or very young may not have access to care due to socioeconomic status, transportation, or lack of knowledge of the importance of health maintenance. Those with disabilities are less likely to have access to care or be insured compared to those without disabilities. And the lesbian, gay, bisexual, and transgender populations are also presented with inequalities and disparities in access to care, which include discrimination based on gender identity and sexual orientation, lack of provider knowledge about the needs of the LGBT patients, and insufficient research about the health of this population. APRNs have the role of providing health across the lifespan through assessment, diagnosis, and treatment of illness and injuries. Some of the core leadership competencies of APRNs include providing leadership to foster collaboration with multiple stakeholders such as patients, communities, healthcare teams, and policymakers to improve patient care, and advocating for improved access, quality, and cost-effective healthcare. Through the use of NPs, patients are able to receive greater access to high-quality care. APRNs are using communication to collaborate with the healthcare team to provide access to care, which improves the health of the individual as well as the population. It is an important step for APRNs to expand access to health services in order to reduce health disparities. Part of the solution is more affordable health insurance. However, other factors that must be considered include economic, social, cultural, and geographic barriers to healthcare. New strategies must also be considered to increase the efficiency of healthcare delivery. Strategies to reform healthcare delivery include addressing shortages of healthcare providers, providing resources and tools to implement activities and strategies to help improve healthcare access, increasing access to preventative services, and the identification of at-risk populations and assisting them to access health services. The overall mission of the University of Mary is to serve individuals of all faiths and provide quality care to others. Providing access to care is an act of generosity in that the APRN is providing their time, knowledge, and understanding in order to supply access to healthcare services for all individuals, regardless of race, sex, socioeconomic status, age, sexual orientation, or gender identity. As future providers, it is of utmost importance that we strive to serve communities and individuals who do not have access to health services, developing trusting relationships and assuring that needs are met. The graduate nursing competency that relates to access to health services is professional distinction, which involves being a servant leader and using professional skills and technical proficiency in order to provide a higher commitment to service. As the APRN uses learned knowledge and skills as a PCP, they are better able to provide exceptional care to individuals and communities with a lack of access to services and educate on the importance of preventative and continued care. In conclusion, barriers to accessing healthcare services lead to unmet health needs, delays in receiving appropriate care, inability to get preventative services, financial burdens, and preventable hospitalizations. Through the use of nurse practitioners, patients are able to receive greater access to high-quality care. APRNs are providing health care across the lifespan through assessment, diagnosis, and treatment of illnesses and injuries. By expanding the autonomy of nurse practitioners, it increases consumer access to primary care, therefore improving the health of the individual as well as the community.